Hello, everyone. Welcome to this session that is a fireside chat with Miltenyi, Dr. Priya-G Hingorani. In this discussion, we'll be discussing how Miltenyi Biotech is driving innovation and creating solutions that are making a real difference in healthcare and life sciences. We'll explore their strategies, experiences, and the lessons they've learned in advancing research, improving patient care, and shaping industry practices. It is my absolute pleasure to introduce our distinguished speaker, Dr. Priya Kapoor-G Hingorani. Dr. Hingorani is a Managing Director for India and Vice President for Southeast Asia at Miltenyi Biotech. She leads the establishment and growth of operations while shaping the future of precision and personalized medicine across the region. Her career spans leadership roles at GSK, Johnson & Johnson, Abbott, Novartis, and Ranbaxy, where she has driven commercial strategy, operations, and market development. With her deep expertise in business leadership and healthcare innovation, she has been instrumental in advancing the life sciences ecosystem in emerging markets. Welcome, Dr. Priya, and we're absolutely honored to have you with us today.
Thank you, Shika. The pleasure is all mine, and thank you for your kind words as we begin this discussion.
Amazing. To start off, before we dive into the questions right away, I would like to know in your words what Miltenyi Biotech is doing currently, what are its approaches, and then maybe we can go into the larger pictures and deep dive into the questions.
Of course, Shika, it's my pleasure. So, Miltenyi has been a company which has been around for 35 years globally and is a leader in cell and gene space. So Miltenyi Biotech India is the entity that we work with, but Miltenyi is basically into two arms. One arm is doing the entire value chain across cell and gene therapy, which is instruments, consumables, reagents, and anything that you can think of in the space of cell and gene. And on the other side is the biomedicine space, and all of us are hearing about this today a lot more, which is called CAR-T, which is a chimeric antigen receptor T cell. So from that perspective, CAR-T is something that is coming up recently. I think the last few years, you would see organizations like Johnson & Johnson, Gilead, Novartis, they all have, and they are all partnering with Miltenyi to build that space. So if we were to look at somebody who understands cell and gene space, somebody who understands personalized medicine, I think right from platforms, so I could say from, the way I define it, from the needle to the rocket, we do everything when it comes in the space of cell and gene.
That's a great analogy.
So Miltenyi Biotech India came into function in 2024. We are just a year and a half old or young in India. And here we are setting up operations of one Miltenyi, which is biotech and biomedicine together. And the team has been building, so people, scientists, researchers, if you speak to, will be very familiar with this name Miltenyi. And now we are trying to bring personalized medicine in the country. Very soon we should be ready for launch.
That's amazing. I think so. That's great news for India that Miltenyi is finally here. But thanks for that introduction. That gives the audience a great kind of layout on what Miltenyi does. So it'll be easier to kind of drive this conversation ahead. To get started with my questions, I would like to zoom out for a moment and just to understand, India is already a global force in pharma and biotechnology, right? So how do you see India's role evolving in the cell and gene therapy ecosystem, both as a market and as a hub for innovation and manufacturing?
So India has always been a hotbed for some kind of innovation, whether it has been technology in the past few decades, or now we are also seeing AI, but we are also seeing cell and gene come through, right? It's early days. It's not early days only for India, it's early days for the global cell and gene understanding. So personalized medicine, if I recall, got mentioned somewhere around 1.5 decades ago in one of those papers where people were talking about it and it seemed more like fiction. And today it's a reality. right? So, in the Indian space, the exciting thing is that there are players already who are coming into the space, and there is very, very heavy investment from the government, both in terms of interest as well in terms of money, to make sure that this section, this area, this therapeutic area thrives. From a regulatory perspective, from a perspective of supporting the industry, grow in and bring in newer brands to the market, um, it's been a pleasant interaction in the sense that regulators do understand what they know, what they don't know. They are looking at partnerships with companies like ours and many others who can bring in cell and gene expertise. And not only that, I had the recent pleasure of meeting the Health Secretary of India, the Health Minister, and of course the head of BIRAC, Dr. Jitendra Kumar, the health of DBT, Dr. Alka Sharma, and all of them are very eager to learn about this space from people who know more than them, shape regulation, shape treatment, shape the entire ecosystem around this, because they believe this is the space to be. So ultimately, I think all of us in this space, so India is, there are various figures. People talk about $350 billion industry in biotechnology and $350 billion industry only in cell and gene. I think the value is immaterial because it will grow. We have a population size, we have people who can afford, the value will grow. There is a need in the market. But what is important is what's happening around us and how is every element in this ecosystem and the value chain playing their role. So for me, India is definitely, every therapy area we speak about opportunities, but I can say this with a little bit of confidence after 2.5 decades in the space of healthcare, that very few opportunities you get where the market is creating a pull, where the stakeholders are creating a pull, where the patients are creating a pull, and you are the provider. Generally, when you are into a commercial area, it's you who's trying to create a need gap, but there is an existing need gap, and we are trying to, fit in there. So it's exciting, it's challenging, but it's also very humbling because you know that you are doing this for the patients, you are doing this to bring in the right treatment for them, especially when there are not many options left for them. So if we can make a difference to any life, one at a time, I think we would have done what we set out to do.
That's very well said. I think so. It is important to also note that India is not, I think so, it's staying in the forefront of innovation, especially in now we're kind of catching up with the trends and kind of being in the forefront, especially in life sciences, pharma, and biotechnology, of course. And coming from you, like that, as you mentioned, right, that's an important perspective with such a industry expertise. So. Thank you for that. I think so. It highlights not just India's potential, but also scale of responsibility as the field advances, right? And as you rightly mentioned, I think so moving forward, like every fast-growing sector comes with its own hurdles. I'm sure there might be some challenges that you might also be facing. So, what are some of the biggest challenges that you foresee in scaling the cell and gene therapies in India, whether it's scientific or it's regulatory or just commercial, right? So, where do you see the greatest, and of course, with the hurdles, where do you see the greatest opportunities coming from?
Yeah. Well, thank you for that question. I think, Shikha, it's very relevant. Everybody looks at this 1.4 billion people and they look at the opportunity size which is created for India. And I think we look at it also, but the lens is slightly different. Because cell and gene is an area of, it's the buzzword today. Like everybody wants to be involved with cell and gene. Everybody wants to talk about CAR-T, personalized medicine. But there's a lot more beyond what this expertise demands, right? While I mentioned to you about the regulatory ecosystem and the understanding around what this should entail, because ultimately it's about bringing the right product to the market in the right form. More importantly, it's also, I think, the right people who are required, well equipped and well trained to get to manufacturing, building, testing, and then using this product. Okay, so patients are there, they are waiting. Customers or the doctors today or the HCPs know about what they are prescribing, but there's a huge chain behind, which for anything in pharma or healthcare is known. You know, everybody knows how to do this, but cell and gene is a lot is unknown. A lot is getting discovered. So where do you get this talent? We have great biotechnology institutes. We have people who are trained. We have superb scientists. I think we are known, for our brain in the world. But how do you make sure that they are bringing the right skills to the table? How do you make sure that they are able to apply what they know and there is an environment to apply it? I may want to apply it. I don't have the equipment. I don't have the know-how. How do I do it? So I think training of these people, building that system where you can have a feeder system to many CAR-T or cell and gene manufacturers, or even any space of cell and gene tomorrow. That will be very important. So I think that's one hurdle, that we have the talent, but do they have the know-how? We have the regulatory system, but we are not ready. And they're not them alone. It's globally. So everybody is learning. The third challenge is access. Yeah, you have the product, you have the patient. How do you make sure that it reaches the patient in time? Because it's personalized. So you need to go do a process of the person's blood, then take it out, then run something on it, and then provide to the patient in right time. So there are many more, but I think these are the three critical ones that we are looking at. And from a point of addressing them, regulatory, I mentioned to you, I think they have had BCG working with them, setting up a cell and gene guideline, but very, I think, open discussions. So we have had with the health secretary, like I mentioned, the BIRAC head, just to get the idea of what can be done in this space. And they are willing to learn from other markets. They're willing to learn from other experts. That I think is a beautiful thing. The second bit in terms of talent and building the talent, and we are doing our bit. So we have an agreement with BIRAC, with THSTI and Miltenyi to train young scientists, young minds, experts in this area on the space of manufacturing cell and gene. So we already have contributed by helping us set up in THSTI. We also have our own setup, which is the Miltenyi Innovation and Training Center at Hyderabad. And we intend to do many more such centers so that we can actually equip our talent to be cutting edge and make sure that they are able to deliver the right cell and gene products to the market. And the third, in terms of access, I think we are also working as Miltenyi over there in being at the point of care, being where the patient is, helping the hospitals and the patients get that timeline difference, because many of these patients are critical. They're coming from far off areas. They don't necessarily have the ecosystem. So how can you minimize that discomfort, and how can you make sure that they get the product right in time to be able to then recover, hopefully, and be well and healthy to get out into the world and live their lives happily.
I think so. That's an honest assessment, but also I would like to add that Miltenyi is not just giving life by its products, but it's also saving lives and kind of shaping the younger minds to kind of access this kind of so I think so. That's amazing. I think so. It's clear, as you mentioned, that the path is quite challenging. But again, the possibilities are really exciting, especially when the government wants to learn and wants to contribute on that. So that's amazing. I think so. Now I would like to kind of shift a little bit to the patient perspective, right? So one of the biggest debates around cell and gene therapies worldwide is their high cost, right? That is not a known. So how is Miltenyi Biotech approaching the challenge of making these treatments more accessible, as you mentioned in the previous, and affordable for the patients in India?
So, Shika, I would like to address this question a little differently. So, access, see, affordability comes on two axes. One is the willingness to pay, and the other is the ability to pay. So I would address it separately. But if I was to look at access, which I just spoke to you about, I think for India, the first challenge is access. Then we come with what is happening, whether the patient can afford or not. We are selling more than 100,000 BMWs and maybe 200,000 Mercs a year. So it's not about affordability. And okay, yes, there is the counter argument will be this is a small proportion of the population. But there is that balance that is there in the society. So I think we often paint India as, unaffording population, do not want to do it. I think the population is not enabled to have this access. So let's talk about the access first. In this case, it is about when the patient is in the hospital. Do I make the patient wait for a month, 2 months? Do they have to come from very, very far-flung areas to, get to their treatment? Because every life is important. I mean, I don't think anybody who is at a different income strata feels that, or a socioeconomic class feels that life is not important. So how do you make sure that they are able to get an access to this treatment? And then therefore the point of care becomes very, very relevant. So whether a hospital or whether a center very close to where the patients are can be created. This is one. The second bit is about affordability, which was about ability to pay and willingness to pay. India, we know, largely is out of pocket and everything. And even if it's Ayushman Bharat or any of the rare disease programs that we take, it still remains a section of it does come out of pocket for the patients. So if that has to happen, yes, of course, we cannot look at the $500,000 mark, which is there globally. We will look at India-specific pricing. But it's also helping those patients achieve the payment of that pricing. So can you repurpose how that comes out, whether it's an access model, whether it's a EMI model, whether it's a financing model, whether it's something else that works within the ecosystem so that the burden is not immediate, but over a period of time when the person gets back their quality of life and is able to pay back, right? So we are working through everything. It's very early days to come to a definitive conclusion and say, oh, this is what it looks like. But the intent is there. The intent is to make sure that the Indian patient gets world-class treatment from a product which is made in India for India and done by the experts in the space of cell and gene therapy.
I feel that's really encouraging to hear, and there's hope, and there's a hope of accessibility for these products, right? Again, affordability and access are often where innovation also meets its real test, like you mentioned, right? You are also working on multiple ways. So I think so your approach is bringing a lot of optimism. Uh, Along with this, like another crucial piece of the puzzle is also the collaboration, right? There is no single organization that can drive this field alone. So what kinds of partnerships, either with hospitals or academia or startups or the government, do you think are the most critical in order to accelerate this field, particularly in India?
It's absolutely right. Whatever statement you have made right now, I think India is a land of plenty, but it's also a land where you cannot decide that I will go alone and I will be able to do this. Globally, you can't do this. India more so, right? Yesterday we were talking, we are 29 countries in one country. So if you have to look at that section and then try and make sure that you are addressing, then you definitely need partners and collaborators and key stakeholders. A couple of them I mentioned earlier, but I would like to reiterate. I think BIRAC, Dr. Jitendra Kumar, has been a fabulous stakeholder and a partner to work with. The approach to make sure that there is access to patients and there's access to cell and gene has been great. So we have a memorandum of understanding with BIRAC, which we are working with them. And as a section of that, we also have a memorandum of understanding with THSCI, again led by very wonderful individuals, Dr. Karthikeyan and Dr. Amit Avasthi, who are passionate about this field of cell and gene therapy. The third is the Department of Biotechnology that is also working with us, and they are keen on what can be developed. There are hospitals that we are partnering with to make sure there is access of the product to the patients. One of our partners is CMC Vellore, who have just done phase 1 trials with really astounding results. I mean, you will hear from a medical, you would have heard from a medical head some time ago in this very seminar, but I think he may or may not touch upon the fabulous cure rates that we are receiving, especially for patients who are refractory and, who are facing challenges in terms of even survival. So in that kind of a difficult group, we have above 90% success rate, and that's amazing. So CMC Vellore, for example, is one partner, but we have many other hospitals, which for confidentiality reasons I cannot name right now, but who are interested in cell and gene, who are interested in point of care, and who want to work very closely with us to make sure that the access of products for the patients is existing.
That's amazing. I think so. As you mentioned also that the partnerships I feel are the backbone of sustainable growth, right? And especially when it comes to healthcare, it's not one field that you can work alone. It's also inspiring to see that how this ecosystem can be built collectively. And as you mentioned, there's a lot of optimism there as well. Uh, Finally, moving forward on just leading such a pioneering company in such complex and emerging field must come with with its unique pressures, right? So how do you personally also balance the immediate pressure of execution, with a long-term vision of transforming patient outcomes?
Um, I'm trying to think how to respond to this because, when you have a passion for something, then the pressure just disappears. Then it's all about doing something which is going to lead to patient outcomes and, deliver that safety, that great life that is waiting for them. And while it may sound like a cliched statement, I think thinking fast and thinking slow very often leads what I need to do for the business. So of course there are short-term results. Of course there is something that you need to do. But starting with the long-term vision in mind and saying that, okay, this is where we want to be. And where do we want to be? We want to lead in the space of cell and gene. We want to provide treatment which can transform lives, which is transforming lives. Today, we are present in the area of DLBCL for liquid blood tumors, but we are soon coming up with something for autoimmune disease. There is research happening on solid tumors. There's something coming up for neuroglioblastomas. And the potential is so exciting. And these are life-threatening ones. And then there is something called exosomes, which we deal with, which helps in beautification of people, right? So every aspect of life is getting worked on. In fact, autoimmune disorders is one of my favorite examples to talk about because I met a patient in Germany this year, beginning, and this young girl, when she got lupus or when she was diagnosed with lupus, was 16 years old. And lupus for everybody is a very debilitating disorder. It is morbid and then mortality because it means the patient is going to have these skin rashes, cannot go out, is going to have liver problems, is going to have lung problems, kidney problems. I mean, you name it, and that organ is going to get affected. So imagine a 16-year-old who is getting bedridden and is told maybe you have 3-4 years to live. And then this patient gets CAR-T, Miltenyi's CAR-T, and today she's a 24-year-old pursuing medicine in Germany. And the pictures that she showed us seemed like a cosmetic ad, a before and after of what was the rash with lupus and then what had happened now. So you can see that transformation. You can see this happening. So when that happens, I think the pressures just seem to melt away. It's a business, so there will always be that stretch that you need to do it. It's a mini startup in India, so we have to work and we have to stretch as much as we can. But I'm blessed to have a team which is equally passionate, and they think about making sure that every day matters, every hour matters, and every patient that's waiting there the faster we can bring our medications to them, the more we would have justified the roles that we are doing in India.
That's an inspiring story. I think so. When hope is the light that you see at the end of the tunnel, I think so. Just passion would accelerate, right? So I think so. That's a wonderful takeaway for all of us. That it's not just in science or healthcare, but that also in just leadership in general, and how passion can drive you. Um, I think so. With that, I would keep this conversation going and going, but we just in respect of time. I would like to thank you, Dr. Priya Hingorani, for those thought-provoking insights. They were really thought-provoking. I think so. It gives everyone, all of us, to kind of think about something. And what we've heard about today is more than just the future of therapies. Is the future of hope for the patients. So,
Yes.
cell and gene therapy represent a possibility, but it'll take vision, collaboration, and leadership to truly bring that possibility to life. Um, and conversations are like this, I think so. They just keep reminding us that India is not just participating in this global movement; it has the potential to lead it. With that, I would like you to kind of deliver any closing statements that you would like to share it across with our audience.
Shika, thank you for having me, and I think it's an honor to be here. I would have been loved to be live. Unfortunately, the pressures that you spoke of are taking priority right now because we have to work to make sure that this comes fastest to the market. So I think that's where we are. I think in the parting remark from my side, for professionals who are in the room, it's not very often that you have this opportunity for transforming a complete therapeutic area or disrupting the way therapy is done today. And when you are blessed with that opportunity, grab it with both hands and feet and whatever you can get to make sure that you are able to make a difference to all lives. So thank you so much for having me. It's been a pleasure speaking with you, with Healthark and RWEsearch. And thank you, Shika. It was absolutely a delight having this chat with you.
Thank you so much. We appreciate you taking all the time and speaking to our audience. Thank you.